We quickly have the next lecture, and this next lecture is cycled around the area of trying to talk about increase in jugular venous pressure. So I've been talking about heart issues lately, and for the heart issues, we're trying to focus on things you can pick up on physical examination. So one of the things you can pick up on physical examination is the jugular vein can be elevated, or you can say increment in pressure. So if you see the jugular vein of a patient, you tell the patient to turn like this, I see something bulbing up. What are the things you can suspect, which is the most important part of this lecture, right? So it's a clinical sign, and it indicates that there's an elevated central venous pressure. There's a increased pressure in the middle. Okay. So it's often due to right-sided dysfunction or fluid overload. We'll get to look at them properly, right? So jugular venous pressure measures the pressure in the internal jugular vein. Now you should know that we have the external jugular vein, which is closer to us here, and the internal jugular vein, which is kind of like up here. So this is what you should be observing, up. Now the internal jugular vein, we actually look at it in there because it connects directly to the right atrium. So if there's issue in the heart, it should actually show up directly. Okay. So it serves as a non-invasive indicator of central venous pressure increment in it. Okay. Now, what are the various causes in the heart? It will show that there's what, since it connects to the right atrium, it shows that there's a problem on the right side most of the times, like right-sided heart failure. You can show constrictive pericarditis, where the tissue outside the heart is thick, so the heart is not relaxing as it wants. Cardiac tamponade, sometimes it shows that there's an issue with the tricuspid valve. Okay, so on the side of the lungs, you can have causes, okay, as related to the lungs: pulmonary hypertension, pulmonary embolism. Okay, sometimes, generally, it could be volume overload, like the kidneys are not really functioning very well to put out waste. Okay. Then sometimes it could be that the patient was admitted in the hospital, and too much of intravenous fluid was given to them, okay, leading to a general increment in the blood pressure.